Today, in episode 182, we're going to address safe social spaces, and we're going to have Craig Leitz and Angie Nilsson for Lines for Life and Youthline, who are going to talk more about crisis intervention and especially into those online spaces. So a great episode to come back from what was a great NASBID conference for those of you who were involved in the state mental health commissioners meetings over the last few days. My name is David Covington. I'm with Recovery Innovations and Behavioral Health Link, and I'm your host for today as we get into episode 182. Talk.crisisnow.com is your go-to resource for everything Crisis Jam, from the past episodes to helping someone new register for the Crisis Jam. You can get a virtual background as well as catch up on what went on this past week. For those of you who were at the NASBID conference, we did a 70-minute version of Moving America's Soul on Suicide. You can watch it on YouTube, that QR code in the upper left, or simply searching Moving America's Soul on Suicide on YouTube. We also encourage you to consider a private screening, and you can go to mesosfilm.com to inquire. If you'd like to have a showing in your local community, if you can put together the theater and bring folks together, it's really at no cost to you. We will provide the cinema grade version for you. If you want to bring in the storytellers or those of us involved in putting the film together, that's obviously a different kind of situation, and we're doing more of that. But help us. We've seen very few mental health industry YouTubes cross the 1 million views mark. We're currently right at 700,000. And hoping to break that 1 million mark by World Suicide Prevention Day, when we will be doing a premiere in the Phoenix area. Speaking of films in the mental health space, how many of you saw Inside Out 2 and thought that was a really great depiction? We're going to put a link in the chat from some of the psychologists, psychiatrists, the researchers who were behind the science of Inside Out 2, and just a tremendous film as they shifted to Riley being 13 years old, and who's going to be the star of this one. Of course, you know, Joy was the star, and depression, or sadness as she was called in the first film. In this Inside Out 2, the main character is anxiety. And so a tremendous film. You want to see the backside of the development of that film. And then one more film that will be debuted soon is a documentary, From Stigma to Strength, from the Georgia Department of Behavioral Health and Developmental Disabilities. They'll be premiering this documentary at the Carter Center coming up, and we'll put all the details into the chat. A host of articles coming out in top national media around the 2-year anniversary of 988. The Assistant Secretary was highlighted in Axios, top Biden mental health official on 988's future. We also saw an article in ABC News. A lot of different forums covered the 10 million contacts over the first 2 years. The New York Times, mental health experts have said 988 hotline for mental health emergencies is still a work in progress in need of more funding, coordination, and awareness. And then from our own, the Crisis Jam community, Chuck Angolia, CEO at the National Council for Mental Wellbeing, wrote this opinion piece. The mental health crisis hotline is working, so why doesn't it get the funding it needs? And Chuck, thanks so much for joining us to say a word or two about the op-ed you wrote.
Well, David, thank you so much for the opportunity. You know, I think every opportunity National Council has, we try to both celebrate 988 and the success of the call center, but also to remind people that there's a lot more pieces that need to be put in place for us to have a functioning crisis continuum in this country, building on the great work, David, that you and others have done. And we just appreciate that the LA Times thought that this was worth talking about.
Chuck, what do you think is the most important next step?
Well, I mean, I think sustainability, right, is one of the big things on everybody's mind. I mean, I hear from our members, is 988 going to be around? And I say, I sure hope so, right? And continuing to really focus on sustainable funding sources, whether that be fees on cell phones. Some states are talking about integrating elements of 988 as they're building their CCBHCs through Medicaid. But I think we need to continue to be creative about finding ways to make sure that we can sustain both the mobile crisis and crisis receiving capacity necessary to supplement the call centers.
Thank you so much for joining us, Chuck, and for your ongoing leadership in that our National Council. I remember, Chuck, you being at that initial press conference with Ajit Pai, the FCC commissioner, right as this was all taking off. And important, this one of the things we do in this community all the time is celebrate how far we've come and continuously make a candid and sober assessment of the work yet to do. So thank you, Chuck.
Thank you, David.
And that brings us into the Crisis Trivia Hot Seat. I know we've had a few weeks in a row where we've looked to you, the audience, but we love to have someone sitting in the hot seat. And our new approach is really to bring teams, because that hot seat is less hot when there's several people in there. And Angela Roberts, a longtime partner and 988 director for Kentucky, brings her team. Angela, how many team members do you have with you today that are joining us? I see y'all are in different videos.
We are. I know at least 4 teammates from Kentucky and one on the phone with us. So
perfect. What are you most proud of about 988 in Kentucky?
Oh my gosh, the successes we've had as a team, and it is such an amazing team that they bring such a depth of knowledge and experience that we continue to improve and make it better for Kentuckians in crisis.
Great. Well, thanks for being here. Our question for today, in line with our social media and crisis intervention for youth, last October, 41 states attorneys generals, I think I got that right, filed a lawsuit in federal court, and Kentucky was one of them, claiming this company knowingly designed and deployed addictive features that negatively impact the mental health of children and teens. And we are having a growing group join that lawsuit of states. Which of the following social media companies was the one targeted by the state's lawsuits? Was it Snapchat? Was it Meta? Was it TikTok? Or was it YouTube? Talk that through, Angela.
All right, Team Kentucky, we've got this. So right off the bat, my first thought was Facebook, and knowing that Meta is the parent company, I open it up to our team to see what you think.
That was my thought as well, although I would like to defer to Levi, because he is our most knowledgeable social media person.
Levi, what do you think?
I was going to say TikTok, but I could be wrong.
Okay, so the audience is split. Let's show the audience. Nobody in the audience thinks it's Snapchat. Well, a few do. A few think it's YouTube, but this is really a battle. It's tied. Is it TikTok? Or is it Meta? That is, and I'm not going to say more. I'm not going to give any more. You guys are saying that Meta is Facebook. I'm not going to confirm or deny that. I'm going to lean on. You've still got the option of phoning a friend, Angela. What do you want to do?
Okay, so I'm going to pull in our director, and the question is that which of the following social media companies was the one targeted by the Attorney General's lawsuits last fall, claiming that the company knowingly designed and deployed addictive features that negatively impact the mental health of children and teens? It's Snapchat, Meta, TikTok, YouTube, and Team Kentucky split. So what do you say? Meta. Okay, so our director, Dr. Patty Clark, says Meta. So she is our leader, and I agree. So we will go with Meta.
Well, and Meta is the answer. It is Facebook and Instagram, right? It's not as much Facebook anymore. Those of us who have gray hair use Facebook. Our children use Instagram, and their children use TikTok. So that's the world we live in. But the one that was focused as part of the lawsuit is Facebook and Instagram. Their primary target due to a few factors. Market influence. There are about 2 billion users a month on Instagram and Facebook. documented internal awareness of these challenges within the leadership at Facebook and Instagram. And researchers are increasingly finding a direct link to mental health crises among youth. Great work, Team Kentucky. Look, Levi's not wrong. TikTok is obviously a source of a lot of legal concerns in the United States for a little bit of other reasons related to the influence of a foreign government, et cetera. But Meta and Facebook and Instagram are certainly taking a lot of the initial focus on this. And that sets the stage, thanks Team Kentucky, for our Youthline leaders with Angie and Craig. Angie, you've been there for a decade with Lines for Life in Portland, getting your PhD at Washington State University. And Craig, coming from your work with LGBTQ students, we're excited about hearing about safe social spaces, crisis intervention for youth on social media.
Thank you so much. Well, good morning from Portland, Oregon, everyone. I'm here at the headquarters of Youthline and Lines for Life. Just really excited for the opportunity to speak to you today. I use he and him pronouns, and I'm the Youthline Deputy Director. I'll hand it over to my colleague Angie to do a quick introduction, and then we'll dive in.
Hi, everyone. Good morning. My name is Angie Nielsen. My pronouns are she, her. I am the Youthline Assistant Director of Clinical Operations, and I oversee the Safe Social Spaces program.
So we are so excited to tell you about Safe Social Spaces. This is a program that started in 2019. Before we dive into the specifics of the program, though, I want to tell you a little bit about Lines for Life and Youthline. This is the third time that Youthline has been invited to Crisis Jam, and we're so excited to be back. Youthline is a service of Lines for Life. Lines for Life has been preventing substance abuse and suicide for over 30 years. We do that through providing hope and help through crisis intervention, prevention, and advocacy. Youthline, a service of Lines for Life, has been in existence since the year 2000. Youthline is a peer-to-peer mental health service that provides crisis intervention for youth across the country. From 4 p.m. to 10 p.m. Pacific, every day of the year, we have teen and young adult volunteers and interns who are the first responders on our help, support, and crisis line. We serve youth ages 10 to 24. They can reach out to us about anything. No problem is too big or too small. We talk to you through calls, of course. We also text with them or chat with them, and they can email us as well. Of course, our help, support, and crisis line is the hallmark of our program, but there are a couple of other things that we do as well. Of course, we have a cadre of volunteers and interns who work with us, so training and mentoring and developing those youth is an essential component of our program. They also help bring youth voice to our program. We want to follow their lead. We want them to help us know the best way that we can support other youth because they are living the experience of being a youth today. And so as we are trying to support other youth in crisis, they help us with that essential work. Finally, prevention is an essential component of the work that we do, and we do that through our education and outreach part of our work. So we go into middle and high school classrooms, and we do mental health lessons that meet state education standards. Additionally, we have an Instagram, follow us at the Youthline. We also have a set of free materials. If you are a youth serving organization or you have youth in your life, go to our website, theyouthline.org, and you can order free materials to provide to the youth in your life. As I mentioned, we serve youth all over the country. So not just folks who are here where we are headquartered in Oregon, but across the US. We want to make sure that youth who want to talk to another youth when they're struggling know about us. And then finally, just highlighting that Safe Social Spaces is under this umbrella of services. So Lines for Life is the 988 center, one of two in the state of Oregon. We're also a national backup center. And then Youthline has been serving youth for almost 25 years. And so Safe Social Spaces lives within this umbrella of services and expertise supporting youth in crisis. Next slide. So if you were here before 9, you got to see the preview video, but if not, the message is that social media is ubiquitous in the life of youth, and it is not going anywhere. You know, there was a study by the Pew Research Center in 2018 that shared that 95% of teens have a smartphone or can access one, and almost half of them say that they are online nearly constantly. A more recent study in 2022 released by the Pew Research Center shares that up to 95% of youth 13 to 17 report using a social media platform, again, with almost a third of them saying they're using it almost constantly. So for us, what we know is that youth are online, they are on social media. And if you are likely aware that suicide is a leading cause of of death for youth in the United States. Here in the state of Oregon, it is the second leading cause of death for youth, and it's either second or third nationally for the age range between 10 and 24. And so we know suicide for our youth is a crisis, and we need to be addressing it. And those things are getting better, and our large social media companies are trying to do better in supporting youth in crisis online. They're not exactly where they need to be yet. And so Safe Social Spaces is a program where we are trying to meet youth where they are. They are online, they are posting about crisis online, and so we want to go out and find them and get them the support they need. Angie, how about you tell us a little bit more about the program?
Yes, if we can move to the next slide, please. So I'm going to go into a little bit of a deeper breakdown of how Safe Social Spaces works. So currently we monitor 6 different social media apps. We are on TalkLife, Discord, Reddit, Tumblr, Amino, and Vent. Reddit and Discord are 2 more well-known social media apps that focus on numerous topics, while TalkLife and Vent are more focused on mental health. Amino has spaces to talk about several topics in addition to mental health, and Tumblr is a blogging site where folks can post about whatever might be on their mind that day. We had looked into bigger apps such as Twitter, which is now known as X, or Instagram, but the challenges with the larger, well-known apps like this is that you already need to be friends with people in order to see their posts. It was difficult to get into communities that might be posting this type of content. So we chose apps that all have public forums so we can see all the posts that are related to what they might be talking about. Since the subs, the servers, and the apps that we are on focus on mental health, it makes it a lot easier to reach out to these people and to have content related to mental health ready to offer these folks. So when monitoring, our social media crisis intervention specialists will go onto one of these communities, and they'll scroll through looking for posts that discuss suicide or self-harm or mental health challenges that were posted by youth. And then they usually click on the profile of whomever posted that, and they send them a direct message that says something like, "Hi, I saw your post. It sounds like you're really struggling today. I just wanted to let you know that I'm going to be online for a while, and I'd love to chat and I'd love to support you." From there, the interaction works a lot like any crisis intervention text. We talk with them about what they're going through. We ask about suicide, we safety plan, and we make sure that they have resources. And as you can see in the slide, there are 3 ways that we work with young people to get them some help. One is that messaging and the rapport building that I already spoke about. One is sending resources, and one is sending, as necessary, sending in-person support. And then about the resources, which I'll get into in just a moment. One thing that was really important was realizing that these resources needed to be online for these teens and young people as well, because as Craig mentioned, that's where they already are. So really building our resource list has been a priority of our project. Next slide, please. Okay, so looking at at the interfaces of these apps that we're on. So Amino is on the far left of the screen, and like I mentioned, it's a network of online communities where you can find anything. So from anime to cats to vegan lifestyles or K-pop. But as well, there's communities where people are talking about mental health issues. TalkLife is next to that. It's one big long wall of posts where you're able to see things that people have put up in the last few minutes and respond to them. Discord has different servers that people connect on that is focused on many different things. Discord was originally made popular in the gaming world, and it just kind of grew from there. And it is probably one of the most popular apps that we are on. Vent, which is on second to the right of your screen, is very similar to Talk Life in that it is a mental health focused app. We search for young people posting about what they might be struggling with. And then on the very far right of your screen is an example of one of our social media crisis intervention specialist profiles on one of the apps. All of our crisis intervention specialists on social media, they use an alias, and they also put a little blurb in about themselves and let them people know that we are there to help. Next slide, please. So as I mentioned before, we do have a number of resources that we give to everyone, whether or not they reply to our DM. So whether they say that they want to talk with us, or they just acknowledge by saying, hey, thanks for reaching out, or if we never hear from them again, they still get resources. 100% resource referral rate, which we are very proud of. We send resources that are relevant to what they have posted. So as examples, we have crisis lines and websites that are ready to give out to these folks. We also refer to several free apps on Android and iPhone that are specifically for mental health. Our team spent a good amount of time researching and trying out different apps so that we could recommend resources to youth that were on their phone, because that's where they are, that's where we're meeting them. They might not want to call a crisis line or necessarily do something out of their comfort zone, but if there's something like a mood tracker or a breathing app that has a picture that can help them work through whatever they're experiencing at the moment, then that is, we're going to meet them where they're at, and that's what we're going to give them. We also have a list of websites that we refer to, highlighting a couple in the middle there. Weavesilk.com is an amazing interactive art site that when you click on it, it makes these beautiful geometric patterns. It's very soothing. Love is Respect is a great place to send teens to learn about the characteristics of healthy and unhealthy relationships. And so, like I mentioned before, that creating this resource list was really a priority of our project, and it's something that we built upon as we advance this project. And I'm going to pass it back over to Craig.
So over the lifetime of this program, and you can go to the next slide, we've served over 3,000 youth. And by served, I mean we've reached out to over 3,000 youth. We're pretty proud of our response rate. We hear from between 50 and 60% of youth. And so almost, over half of youth are getting back to us and saying, thank you for reaching out. Those responses then turn into about 30% of the total people who we've reached out to, we have a conversation with. So we are cold calling essentially on the internet, and we get a 30% conversation rate, which we feel really, really proud about. One of the things that's really interesting that we've found is the amount of queer and trans youth that we are supporting through this program. So we do not ask for demographic information. It's a crisis service. We aren't often doing a demographic survey, but if it comes up over the course of our conversation with a youth, we will track that information. And so what you're looking at right now, the two graphs on the screen are the reported sexual orientation and the reported gender of those youth who we've gotten that demographic information from. And if you look at these charts, what you can see is the overwhelming amount of, in particular, queer youth that we're serving. What we are tracking, 2% of the youth who have reported their sexual orientation to us are straight, right? So only 2%. The rest are somewhere under a queer umbrella. And then we have upwards of 11% of youth who are reporting that they're not cisgender, that they might be trans or non-binary or a different gender. And so, as others have talked about, there is this idea that there's a lot of risk and maybe negative impacts for youth for being on social media, but there's a lot of good as well, that there are youth, and maybe in particular youth from queer and trans communities, who are seeking support, community, resources, and help online. And so our goal with this program is to meet them there, is to find them and help them if they are struggling. The last thing that I'll share is just how we measure our impact or our success with this program. So over the history of this program, staff have created two rubrics. One rubric assesses risk, and the other assesses safety. And so we use these two rubrics to develop a score for risk through the conversation that we're having, through the topics that youth are speaking about related to their mental health, suicide, self-injury, and we determine a score for how at risk we think they are. We then, through the course of the conversation, use that rapport building, that safety planning, that self-care planning to help youth get to a place where they can commit to safety and perhaps will commit to a number of self-care activities that they will do following the interaction. And so at the end of the interaction, we use a rubric where we develop a score for their safety. And the difference between those two helps us determine the extent to which we have been able to support these youth who are experiencing crisis and posting about it online. The program, as I said, started in 2019. We still feel like we are a new and growing program. But as I shared throughout the lifetime, we've been able to reach out to over 3,000 youth, get all of them resources, hear back from about half of them, and then support a third. So we are hopeful that we will be able to continue growing this program and supporting even more youth who are posting online about their mental health struggles. So thank you so much for having us. We really appreciate the ability to talk about safe social spaces today.
Craig and Angie, wow. The chat room is full of comments about the relevance of this great material. And I think there's a lot to absorb here that we're going to want to come back to. Several of you are asking about getting the information, the slides, et cetera. And I just want to reiterate, all of these crisis jams are on YouTube. Will be posted in the next 48 hours or so, as well as the PowerPoints and the decks are at talk.crisisnow.com. But we want to come back to a lot of this. But let's start with a discussion, some quick comments from our roundtable. And we're going to start with Dr. Aya Zarikli, research scientist at Johns Hopkins.
Hi, it's really great to be here with all of you. And I have also the honor to work with Craig and Angie as well. So I'm a big fan of the Youthline. So I come from the AI side. So I have done a lot of work on applying AI for mental health. And we have done a lot of work for for instance, trying to help high-risk individuals on specifically like Reddit and some other resources that we can access. Of course, now social media, this is a different conversation about like the privacy, but it's much harder to access posts. So I think what the Youthline is doing is really amazing. It's so powerful and it's very, very important. And we would love to kind of like to empower this work even further and make it like more generalizable, is to maybe couple it with some of these like AI techniques so that we can maybe cover and help other like youth members. And I will leave it now to Carlos maybe to give a comment.
Sure. Thank you. So I've also have the fortune to be working with Craig and Angie for now almost over a year. And part of our commitment and big questions that we're trying to develop with this team is reliability, sustainability, and how to scale out the program. So a few things that other members mentioned before with terms of sustainability is how to make it so that as new facilitators, as new trainees, as new peers come on board, how we can then sustain that level of fidelity and level of effectiveness for the program. So we are working with we're looking at these data to incorporate fidelity monitoring and feedback from a linguistic point of view, so that these programs can then scale out and hopefully develop some tools that other people can use for that risk assessment and risk training. So yeah, super excited and happy to share more on that.
Terrific, Carlos and Aya. Genevieve Castle, Youthline team lead and social media crisis intervention specialist.
Hi, good morning, everyone. My name is Genevieve. Like was just said, I'm a Youthline team lead. So most of my job, I'm spending time on the actual Youthline crisis line, supervising our youth volunteers. And when I'm not supervising, I'm doing social media crisis intervention. with Safe Social Spaces. So I'm one of the people that goes on to these apps and finds people that are posting about self-harm or suicide or mental health crisis, and reaching directly out to them and engaging them in a crisis intervention outreach. I do about 8 hours a week of Safe Social Spaces, and talk to around 6 people a week, I would say.
Wow.
So yeah.
Genevieve, look, we've been tracking this for decades now. Of when we started, you had to outreach for help yourself. If a family member or friend made the call to the 1-800-SUICIDE 20 years ago, for example, the common practice was there was not much we were going to do for someone else. But that has shifted over the course of time more and more, to the point that you're now at Lines for Life. You've got people calling 988 or local crisis lines. You've got people calling the Youthline, but now you're also actively, proactively, one of you called it cold calling. You're outreaching someone who hasn't contacted you, but you saw their concern on Reddit, Discord, etc. And you're getting these phenomenal people coming back to you. Talk about that initial outreach, and what do you think is working that people are saying to someone who just, again, in this era of scams and all the calls that we get from telemarketers, how is that so effective that people are coming back to you?
Yeah, I think for better or for worse, a lot of youth are really open to talking to people on social media, which, yeah, again, like has its ups and downs. But for the most part, I think the casual nature of social media and reaching out to people on social media is something that makes youth really comfortable. When I approach a conversation, I really come at it from the standpoint of I'm very casual, more casual than I would be if I was taking a call or a text on a crisis line. Really just engaging with the youth, being very chill. I use a lot of lingo that's very popular with youth. But it's very much just, hey, I saw your post. Sounds like you're going through a super tough time. If you want to talk about it, I'm here. No pressure to respond. I can send you resources if that feels better. So just very casual, no pressure. And I think a lot of people, especially youth, respond really well to that compared to the formal nature of a lot of crisis resources.
So Genevieve, there's a comment in the chat right now about how merciless some of these online forums can be. It has to be a splash of cold water. No, like a warm breath, some warm air coming your way to get this positive outreach in the midst of all that. So what does that initial outreach say? What does it look like?
Yeah, I think there definitely can be a lot of tough stuff on Reddit from my experience. There's a lot of sorry, my cat is like absolutely not leaving me alone right now.
The tail keeps coming in front of the camera.
I keep pushing her away. Yeah, there are a lot of posts that are, pro-suicide, people asking for tips on how to complete suicide, stuff that's definitely very high acuity and can be very hard to see. People definitely can encourage people to make those choices, and that's pretty tough. But on the other side of that, there also is a lot of strength in those communities and a lot of people that are wanting to help, which I think is really beautiful and really shows the power of, working together to help each other. But yeah, that outreach that I am doing, for the most part, I am met with a lot of support and appreciation. It's very rare that someone responds and is like, leave me alone. Like, why are you messaging me? Like defensive.
Yeah, that's terrific. Craig and Angie, your thoughts on the team that you have with Genevieve and others, and how you recruit them, how you retain them. How does all that work?
Yeah, Angie, do you want to start or should I begin?
Our social media crisis intervention specialists are phenomenal. They know how to engage young people who might be struggling, communicate that they care and that they want to help, which I think, when a stranger reaches out to you, kind of what Genevieve was saying, when a stranger reaches out to you online, I mean, there's definitely a guard up. and just like, what is this person's intentions? Why are they reaching out to me, kind of thing. But I think that our crisis intervention specialists and the way they communicate, the genuine warmth and compassion behind their messages really is inviting. And, there's no pressure, like Genevieve said, there's no pressure. If they don't want to talk to us, that is totally fine. Here are some resources. We really hope that you're doing better. But if you do want to talk, we are here. And I think that just knowing that there is someone out there that cares about what they posted can just do so much for that person's, just how they're feeling. And just how their morale and their spirit is just fabulous, knowing that someone out there genuinely cares.
Oh, great.
We have
stuff.
4 staff right now who are reaching out on social media. 3 of them are current graduate students in behavioral health fields, and Genevieve will be starting a mental health counseling master's degree in the fall, which we are so excited about for her. And so we have, they are, older youth, right? We serve 10 to 24. They are in the early 20 range. And so they still fall into this youth category and are able to connect with other youth who are posting online.
Terrific. Carlos and Aya, let's bring you back in for a moment. We talked about the lawsuit against Meta that's going on. Obviously, they are seeking changes, and we're seeing changes occurring. When we've been posting YouTube videos forever, and in the last year, there's a lot more self-rating of content, whether this is appropriate for youth. What are you seeing as the things that need to change in this ubiquitous social media to make it safer? What are you aware or knowledgeable of what the states are seeking, or what do you think is needed as we move forward?
So I think like one of maybe a story from before, so I helped with a workshop from the National Academies of Science, and we invited and that was focused on suicide death prevention. Using kind of data science techniques. And we invited a lot of the social media, names to help us come to the table to discuss some of the algorithms that they are, using. But unfortunately, we didn't really see a lot of cooperation from their end. They prefer not to. And I think as a first kind of step, we probably do need to understand how these algorithms work. It's great that they are now trying to work and make it safer, but still, we do need to understand, because these algorithms, sometimes they are biased, they have kind of unpredicted outcome. So we really need to be transparent about these things with the scientists as well, because there is a science behind these algorithms.
Last comment from Carlos.
It's so clear to me that this is so much more the wild west for children and teens. If we leave that on its own accord, it's coming back to the cigarette era, where cigarettes were just being promoted among children. I think there exists a number of developmental trajectories for what is adequate for children, and we need to rely on what we know and incorporate that to those guidelines, because otherwise is wild west number 2.
Yeah. So, but the Wild Wild West, if you think back to that Oregon Trail, a lot of people died, but there were some amazing places at the end of that if we could get through to it. And wow, I love having Lines for Life on the program. This was amazing. Thanks to all of our roundtable, to Angie and Craig. Genevieve, thanks for you and the work that you do. Aya and Carlos as well. And we'll, Dwight Holden, I know you've got to be very proud of all the work that Lines for Life is doing. Karen Jones, I'm thinking Sophie Shev. We hate not having Sophie here today. Sophie's a student at Stanford and a national leader in calling on social media companies to be more responsible in this space to help structure this work as we go forward. So great discussion. Really appreciate all of this. And we're going to plumb down. I think I'd love to have Carlos and Aya both back as potential featured speakers as we go forward, maybe Genevieve as well. And there was so much rich content that you just touched the surface of that the audience wants more about. So Angie, Craig, we'll be coming back to you to maybe even take some 3 to 5 minute segments and drill down on some of these resources as we go forward. So thanks everyone for all of that. I want to spend just a moment. If you were in the pre-show, I went through about 80 slides on the Crisis Now 3 event in Amsterdam. We had 120 people from 13 countries. Quick 30 seconds on that. We had a great fireside chat with Monica Johnson. We did 12 trivia questions, 3 over-unders, 5 lived experience TED Talks, 3 debates, and 3 crisis immersion tours, as well as 5 panels and a lot more in 2 days. So it was complete. And we had a gala where we awarded Dr. Richard McKeon a Visionary Leadership Crisis Award for his decades of impact shaping both suicide prevention and crisis care, 988 and more. And Richard, it was terrific having you as a key part of that event, and glad to have you here today for the SAMHSA update.
Thank you so much, David. And it was an incredible honor both to be in Amsterdam for the tremendous Crisis Summit. I learned so much visiting 113 in Amsterdam and through the various presentations. And of course, I was honored and humbled by receiving the award. That was really deeply meaningful to me. So thank everyone who was involved in that. For today's SAMHSA update, I'm just going to go over several different things. Obviously, as everyone knows by now, we've just gone past the 2-year anniversary. There are loads of events. I won't try to detail them specifically. I was really glad to be able to be at an event at Community Crisis Intervention Services in Hyattsville, our 988 center that plays such a crucial role in the 988 network, along with our Assistant Secretary, Miriam Delphin-Rittman, and Congressman Steny Hoyer, and Congressman Glenn Ivey also participated in that. And it was very heartening to hear about their support, and they were also very interested in some of the things that we shared, including, for example, that the percentage of those with current suicidal ideation who access by text or by chat. We are continuing to work on setting up a monitoring and evaluation process for the National Strategy for Suicide Prevention. And I think as that gets more finalized, I think it would be a great topic for the Crisis Jam, for folks to have a sense of how we're looking at kind of making sure that the national strategy is being implemented and what that impact is. I was also pleased to spend last week at the VA DoD National Suicide Prevention Conference. I wasn't particularly pleased to be trapped in Denver, but I don't think my colleagues in Atlanta probably have a lot of sympathy for me, given the problems that you all have had there. But it was a tremendous event. Secretary of Veterans Affairs presented, Terry Tennelian from the White House presented. We had 2 sessions on 988, along with Dr. Chris Watson from the Veterans Crisis Line, as well as DoD representative. And I just wanted to mention to you about one session I went to, which was with Peter Britton, which was on the issue of what VCL is learning about emergency dispatch. Now, that's the term. They have changed from the term emergency rescue to, I think, the more appropriate term of emergency dispatch. And this is obviously an important issue for the 988 crisis line, but also for the VCL. And they will be having a couple of publications coming out on what they're learning. Their rate of emergency dispatch is higher than for the Lifeline as a whole. Theirs is about 4%. They reported that in previous congressional reports, while ours is under 2%. Peter thinks that that might be accounted for by the fact that veterans who die by suicide disproportionately use firearms compared to the rest of the US population, and that on these high-risk calls, a firearm is more likely to be present. SAMHSA and Vibrant have been working on, and we think should be released shortly, a white paper that gives information on where that 2% number comes from, the various data sources. Chris Drapo at Vibrant has done a lot of work on this. We did present on it publicly, both at AAS and at the crisis conference in Chicago. But these are really crucial issues where we need to continue to work to improve our data, because these are the daily life and death decisions that are made every day. And I know Chuck earlier in the jam, talked about how much work needs to be done. And this is an area, while we have a tremendously valuable evaluation project in the works, we also need an ongoing data stream so that we can answer questions like, somebody is making a suicide attempt and they call 988, right? And then we contact 911 to get emergency medical services. What happens, right? Right now, we don't have very much information regarding that. That's something that we need to continue to build out, as well as better understanding the times and the purposes and protocols when the police do need to be engaged, which we think is actually far smaller than the 2%. So these are really important issues. We're working on them actively. It's part of the action plan that was part of the national strategy, and we will continue moving forward to try to advance these important areas.
Terrific, Richard. Great stuff. Let's now go to the NASBIT update with David Kinsler, Chief of Staff with the New Jersey Division of Mental Health and Addiction Services. Richard referenced the travel woes. I actually was caught in Phoenix on my Delta challenges and couldn't get to the amazing NASBIT conference this past week. But David, you're going to talk to us today about peer support acute care diversion in New Jersey.
Yes, thank you, David. So today I'm going to discuss services that began a little over a year ago, which we funded through our COVID supplemental funds. This initiative places individuals with lived experiences in our psychiatric emergency services and our emergency departments and is separate from our 988 initiatives. The focus of this initiative was to work with a cohort of adult individuals that have a history of presenting multiple times at either the screening center or the emergency department. Many issues cause this, including the need to connect to services. There's sometimes medication issues, or just often someone needs to have additional social support and education. The role of peers placed in the screening center or emergency department was to outreach and follow up with individuals that need that additional support. And so you can see here the goal, the main goal on this slide shows that our goal was really to reduce the need for psychiatric emergency screening or emergency room visits when other services were more appropriate. Next slide, please. These services were staffed by a certified peer specialists and peer coordinators and/or peer coordinators. The peers assist with making referrals, doing warm handoffs, navigating resources and systems, and providing overall support for individuals. you can see from the numbers from the previous slide that we just went over that those individuals served has ramped up. This started in May of 2023, and the numbers that we got at the end of the year was 2,745 individuals served at that point. You can see that the numbers show that the hours that are provided for those individuals is great. There was a significant amount of hours provided for community outreach and case management. We also provided assistance with development of RAP plans or wellness and recovery action plans, as well as in New Jersey, we have psychiatric advance directives that were developed, and you can see that there. Next slide. This slide shows that various linkages that were provided, majority of those linkages were for mental health services, but other services focused on addressing the social determinants of health, such as housing, food insecurities, medical, including dental, and any educational resources that the individual needed. And this demonstrates the connections that were made. A number of services focused on simply addressing medication issues and connecting individuals to prescribers. And last, there was the significant number of connections with substance use or co-occurring treatment services. Next slide. Finally, this slide demonstrates the outcomes of the program. And we are pleased to report that 85% of the individuals did not have a repeated screening or hospitalization. 10% had a screening or visited the ED, but did not need to be hospitalized. And only 5% were hospitalized. And this is a cohort of individuals that had repeated hospitalizations or visits to the screening center and/or. So this is pretty remarkable. The average cost for each of these programs was around $150,000. So it was quite a small investment for such positive outcomes.
Terrific work, David. And keeping in theme of the day, youth to youth, peer to peer, some large outscaled impact of this work. So thanks for sharing with us today. I'm not sure whether Tom Betlock has been able to.
I'm here, David.
Tom is here.
Yeah, good to see you.
Glad you're here. It's time for Medicaid Front and Center, Tom.
Yeah, and we've got a special guest today. We're going to welcome Kristen Baronio from CMCS, who's a senior advisor there. And she has the challenging work of taking all the lovely work SAMHSA working on and translating that into Medicaid work. So, we have spent many of these calls talking about advocating and working with Medicaid. From this group, we've heard that financing is one of the top topics. So Kristen has been working, and CMCS recently released a paper that identified some funding opportunities in terms of leveraging Medicaid. So Kristen, I'm going to turn it over to you to talk about your lovely letter that you sent out to all the state folks roughly a month ago, and specifically how it relates to 988.
Sure. Thanks, Tom. Glad to join you all this afternoon. It's afternoon for me anyway. So I did want to also mention, we recently issued, in light of that really interesting presentation on peer supports, the Center for Medicaid and CHIP Services also recently issued some FAQs on Medicaid coverage for peer support. So I can include that link in the chat in a moment. But with regard to this letter that Tom mentioned, this is an informational bulletin. It's one of the ways that we at CMS communicate with our state Medicaid partners on different issues and opportunities. And what we wanted to highlight in this particular document was how state Medicaid agencies should consider implementing some Medicaid IT system innovations to increase access to mental health and substance use disorder treatment and care coordination for Medicaid beneficiaries. And this letter really kind of highlights for state Medicaid agencies the opportunities that exist with an enhanced match, a 90% federal enhanced match for state expenditures to develop, design, install information system technology. And then there's also a 75% for maintenance and operation of those systems in ways that can really help address what we know is a big gap in terms of participation of mental health and SUD treatment providers and systems in electronic health information exchange. The letter goes over some of that background, making sure that our state Medicaid agency partners are aware of this. I think they generally are, but just kind of talks about how, IT systems can really help with improving access, pointing out there are high rates of mental health and SUD conditions among Medicaid enrollees and how that affects, the comorbid physical health conditions that are often present among beneficiaries with these conditions, how integration is really important. Integration of mental health and SUD treatment is really important for addressing both of those kinds of conditions. And IT can really be helpful with improving integration, how telehealth can be helpful, and how IT systems, Medicaid IT systems can support, telehealth, provider to provider consultations, and important, relevant to this call, availability of crisis stabilization services. Talks about this gap that we know exists in terms of availability, connections between mental health and SUD treatment providers and these IT systems. And then gives a number of examples of ways that we think IT systems can be structured to help facilitate exchange of information between mental health and SUD providers and hospitals, crisis stabilization systems, et cetera. So there's a number of examples there in this letter. And one of the key issues to understand, I think, as you're, perhaps considering engaging with your state Medicaid agency to highlight these opportunities is that these systems have to be state-owned and operated. There's limitations in terms of this federal Medicaid funding. It cannot go to paying for provider-owned EHRs, for example. That's what was funded through the HITECH Act, and we know did exclude mental health and SUD providers, and then we think is part of the reason for this lack of participation. Not the only reason, but one significant reason. But anyway, this funding can't go to sort of fill all of the gaps, including that lack of EHRs and IT systems within provider practices and specialties, psychiatric and SUD treatment systems. But it can help to build up internet-based systems or state-owned systems that can interface with those providers and help improve connections. And another key point that's described in detail in this informational bulletin is how states do have to take into account that anything that they do, any kind of electronic information exchange system they do set up that is broadly available and does help Medicaid beneficiaries access care, does, if it's available more broadly, there has to be a sort of a cost allocation to allow for accounting of how much of this system is going to directly benefit Medicaid beneficiaries. So the letter walks through exactly what state Medicaid agencies need to do to demonstrate that allocation of costs, and does use 988, a crisis call system, as an example for how you could allocate costs appropriately to Medicaid and access this enhanced match to help fund some of that.
Kristen, thanks so much for that summary. Unfortunately, we're out of time, but I would really encourage folks to take a look at the letter. It's very well written. It is 19 pages or something like that, but there's a lot of great details in there in terms of, I don't know where else you can get a 9-to-1 match. So strongly encourage folks to take a look at that. And thanks so much for your work on that and all the other things you're doing to support crisis services within CMCS.
Great stuff. Thank you both, Kirsten and Tom. And we'll hope to have Kirsten back to talk about success as this goes forward. Stephanie, you and Brian have a minute to give us a highlight of 2 years of 988.
I was going to go through some of the bullets, so I'll just highlight a couple. So last Tuesday was 988's 2-year anniversary, as we know. 988 Lifeline has answered more than 10 million calls, texts, and chats. The Biden Harris administration through HHS has invested 1.5 billion into 988, and most of that funding has gone towards staffing 988 crisis contact centers and improved response rates. What I thought really stood out was the nationwide answer rates have managed to keep up with volume increases. But when you start looking into the states, there's greater variability. So I wanted to bring on my dad to see what his reflections are on 2 years of 988.
So Stephanie, thank you. It's always great to spend time with you. So thank you very much. So as I reflect on the last 2 years, basically it's impressive how far we've come, but also we've got a long ways to go. I think we're still in the first 20%, and we've learned a lot, but when we look at the penetration across the country, we know that we still have a long ways to go in terms of the penetration to the average person. We see a lot of things that make us very optimistic, including the fees, including the work that the private sector is doing in terms of payers. So we're optimistic and hopeful, and thank you for the opportunity, and stay positive, people.
Thank you, Brian. Thank you, Stephanie. And Brian, I think a lot of that progress has to do with the momentum, and the momentum comes from, I think, an unprecedented marriage between the federal and state. And thank you so much for your leadership with NASBID as the state's partner with SAMHSA and CMCS and others in unprecedented ways. We're going to keep this ball rolling as we go forward. Tremendous presentation from the Lines for Life and Youthline team today. We're going to share more of that. Next week, we have Dr. Laura Eovine Sykes, Crisis Services Supporting Care in Early Psychosis. And the following week, a titan in this crisis industry space, Phil Evans, on underwriting crisis capacity, the firehouse model. Thanks so much for joining us, and we'll see you next time on the Crisis Jam.